Dear colleagues, I am Dr. Anil Shah from Suryakanta Hospital. This video demonstrates SNARE bisection with multifocal implant. Our aim is phaco-free manual Monson cataract surgery at zero cost. This is a challenging case in which pupil is non-dilating, iris is floppy, hard and brown cataract. Rhexis runaway is a doubtful thing. Very difficulty in prolapsing the nucleus into the anterior chamber, and cortical management is also very tough with implantation of multifocal IOL. Now here the rhexis has been done after staining the capsule, but at this point it appears that the rhexis has run away, but with the maneuver the rhexis can be completed. Now the pupil has become very small. I am doing hydrodissection and hydrodelineation with 22 gauge cannula with the tip facing downward. It is connected to the irrigating bottle. Now with the SICS hook, I am trying to nudge the one pole of the nucleus, but there are firm cortical and nuclear adhesions, and so nucleus cannot be separated and the pole cannot be pulled out. This is my second attempt, but even with the SICS hook, I could not find the cleavage and could not prolapse the nucleus. This is a third attempt in which I am again trying to place the ball point below the nucleus edge so as to lift the nucleus, but again it could not be completed. Now I am trying from the opposite side, and somehow I could get the edge of the nucleus with ball point multipurpose manipulator, and the nucleus is prolapsed into the anterior chamber. This blunt point manipulator is very safe. You can go blindly behind the nucleus without damaging capsular rim. Now half battle is over. The nucleus is made free floating into the anterior chamber by injecting OVD, and with the SNARE, this nucleus is bisected into two pieces. A clear-cut bisection is done without damaging any intraocular structure. Nucleus halves are separated with OVD. Adequate amount of viscous is injected below the nucleus so as to lift the pole. Now with the thin long McPherson forceps, the half of the nucleus is removed. McPherson forceps held the nucleus along the entire length. Now another half of the nucleus is brought into the center by injecting adequate OVD so as to make nucleus free floating. I use sodium hyaluronidase in all these type of cases. Now this second half of the nucleus is also removed by McPherson forceps easily. McPherson forceps is very safe in hard cataract. Now cortical cleanup is done by irrigating, but the pupil has become extremely small. It is almost less than 3 mm, and cortical aspiration has become very difficult. But here I am using my lateral facing aspiration port, which is very safe in this type of cases. This lateral facing port can go below the iris, below the capsular rim, and can aspirate cortex deep up to equator without catching iris or without catching anterior capsule. So it is absolutely safe when the pupil is becoming very small. I have never used any pupil expander devices or any hooks, but with this lateral facing aspiration port I could manage cortical aspiration in this type of situation without any problem. Now almost all the cortex is removed. Anterior chamber is filled with the viscous so as to make it deep. Multifocal IOL is implanted in the back, and the anterior chamber is cleaned, and viscous is removed. Hope you like this technique. Thank you very much.